And in studio tonight to discuss further about sickle cell anemia, we have Dr. Frederick Okinyi, who is a practitioner of hematology at the University of Nairobi, and Peter Ahago, who is a parent to a child with sickle cell disease. Karibuni sana to K24. Now, Daktari, in simple terms, how does sickle cell anemia come about?
Sickle cell anemia is an inherited condition. That means that you acquire it from your parents. So that means one of your parents must have the abnormal gene that causes sickle cell. And in terms of getting it and probability, you know, when, take for example, you are planting seeds. And each seed represents a different category. So one seed, call it red, represents sickle cell. Two seeds which are green represents carrier. And one seed which is white represents normal. So when you are planting seeds, each time you throw it blindly into a hole, any of them can get planted. So that is the probability. So probability of getting a sickle cell, a child with sickle cell is 25%. And when you are going to plant the next one, you have to redo it again. So it doesn't mean that when you have 4 children, 2 of them will be carriers, 1 will have the disease, and 1 will be normal. No, it's a probability that changes at age time with the gestation, so with the pregnancy. So that's the best way I can give to explain how people get sickle cell disease.
So at what age did your son or daughter get this sickle cell anemia?
Yeah, my first born, who is a girl, was tested to be sickle cell anemia at age 5.
Wow.
But before then, she had a series of challenges health-wise. We didn't know until such a time she presented with some signs, and we were advised to go test for sickle cell.
And which kind of signs were these that you noticed?
Jaundice, that is the turning of yellowness in the eye and the body, fever, and pain in the joints. She could not walk. She could not even eat properly. So we were advised to go carry out the test, and she turned out to be positive at age 5. Yeah.
Daktari, at what point should a child or a couple be screened for sickle cell?
I think, let me ask you that as a lady and probably a parent.
A parent, not yet.
Okay, fine.
Okay.
That makes it even better. Now, if you get a child at birth, then you are screened for that child and you are told your child has sickle cell. How do you feel?
I think I'll feel confused. You know, is it in my family? Do I have it? I don't know. I don't know what I would feel.
So you see, that's very natural. That's the reaction of a lady, and especially a mother at the time of birth. You see, childbirth brings about joy, happiness, and there's a lot of, you know, you are welcoming a new member of the family. And you know, you don't need bad news at that time. Of course, there are countries who insist on what they call neonatal screening, and you know, that is what they are recommending. But you now, as a potential parent, I've seen your reaction. Now let's go back to him. Your child was diagnosed to have sickle cell at the age of 5.
5 years.
So that is when it was diagnosed. That doesn't mean the disease was not there.
Yes,
it
exactly.
was there. So it was only discovered at the age of 5.
So either him or his wife carried that gene?
Definitely.
Both of us.
Yeah.
Both of you
Both
carried
of
that
us.
gene?
We are both carriers.
You see?
Okay.
So, so you have to be a carrier. And just the example I was giving you, you know, it's a probability. So that means that the first one had sickle cell. It can follow. You can never run. We've seen families where, you know, all the children have got sickle cell. One has sickle cell, the other one is a carrier. So it's just a random probability. Now, when let's go back. If at the time of delivery, you are told that this child has sickle cell, how have you felt as a parent?
Yeah, first of all, you have to understand what sickle cell is. Before then, we could only remember what we learned in high school about genetics, but seriously, we didn't know the consequences and how one looks to be sickler. So even if you told me that my child has sickle cell without further explanation, I wouldn't have understood what you are talking about. But now that we are in it and we know what sickle cell is and what it does to kids, then I will be so much disappointed at some point.
So exactly. So you see, when you ask me at what point we need to test,
Yeah.
you can see what others are recommending is screening them immediately they are born. And in fact, at one point we are saying we should coin the screening and integrate it with the Beyond Maternal Death campaign, so that all the mothers, when they get their newborns, they are screened immediately so that we know the condition. But you can
So
see,
basically it's when I've given birth.
when you do that, you can see the emotional reaction, and especially for women, some of them suffer psychological depression, and in my opinion, and based on the reaction, you see, you have to take care of the patient first. This is social medicine, basically.
Yes.
So we need to have programs that integrates proper psychosocial counseling, tells the mothers about sickle cell disease, especially we take the advantage when they have what we call antenatal care, so that when a mother comes, you know, they are tested for so many conditions during that period when they are pregnant. This is the time you need to bond. Talk to the mothers about sickle cell disease, let them learn about it, then the time, and then you also get information. If like now in this case, the wife is a carrier, if the wife happens to conceive again, during the antenatal period, she's supposed to be cancelled. So at what point we do the screening, my opinion is that we do it after a child has been born, maybe 6 months later, and you coin it with the immunization program.
Perfectly said, Dr. Perfectly said. Now, in Gloria's package, she did mention that sickle cell seems to be high in malaria-prone areas. So what is the interrelation between sickle cell and malaria?
So sickle cell is a disease that comes as a result of a defect in some proteins in the body called genes. So it came as a result of the body trying to defend itself from severe effects of malaria. And if you look at the equatorial belt, Mediterranean region, that is why we had pressure of malaria infections, and it ended up causing that mutation. So traditionally, all areas which have been known to have high occurrence of malaria have been getting sickle cell. So it will occur in your body, and you know you are not born with it, but next time you are getting a child, the child ends up with sickle cell. And also, in a way, it was also protective, because you find that the red blood cells are supposed to live for like 120 days. But then now when you have the malaria parasites within the blood, they kind of break down, called hemolysis, before they reach the lifespan. So before they mature. So you find that if malaria parasites are within the red blood cells, that red blood cells will break, and the parasites will not have the opportunity to mature to cause a severe disease. So it's also protective in a way. And basically, people who are carriers of sickle cell don't get severe malaria compared to normal population.
And as a parent, I'm sure you have been facing, it's challenging also, of course, financially.
Exactly.
So, you know, having a child with this disease. So how have your challenges been?
Financially, the challenge is massive, as you've said it, because you don't know at what point or when are you going to visit that. It can trigger any time. Even right now, I'm here in the studio. I'm just worried, how is my daughter? And remember, I have two of them, the firstborn and the secondborn. So I'm just wondering what could be happening to the firstborn, who is Adasa, or Serena, the one, the secondborn one. So the challenges are many. You can't be at ease wherever you are. Your mind is just home. Secondly, financially, the pocket always, it has to be full, because, for example, right now, when I receive a phone call right now, I'll start thinking about how will I get to the hospital? Where is the Uber? Do you have some deposits? Do you have, some drugs? Because remember, also insurance, at some point, these chronic diseases like sickle cell, not many companies do accept to register you, even if you are able. So always you are expected to have some money. So remember, I mean, a situation whereby you don't have money, you have a patient, what do you do?
And just to cut you short there, as a parent, how do you create awareness to other parents about this?
Yeah, what we have been doing of late, we actually, I and my wife, we've been advocating for awareness. We have a support group. Also, we have places we go for meetings, and we talk about sickle cell, family meetings in churches, schools. We emphasize on sickle cell. And again, we also advise young people who intend to enter into marriage to screen, because we understand that not one parent can give birth to a child with the sickle cell. Both the mother and the father must be carriers. So before you enter into a serious relationship, much as you love each other, but it's advisable that you have this in mind.
Okay.
You go for screening, so that even after the marriage, the probability that the doc talked about here, you know, okay, we are vulnerable, we can have a child with the sickle cell.
Okay. And another question, are you aware that there's a Sickle Cell Foundation, and are you a member of it?
Exactly. Currently, we are working with the Children's Sickle Cell Foundation of Kenya, and our main objectives are to advocate for sickle cell, advocacy that is, and also we organize training, and also for screening. We advise people to go for screening.
Okay.
And also counseling.
Okay.
Yes.
Dr. what are the treatment options in managing the disease?
So the treatment options for sickle cell, I can say, are basically supportive and definitive. And even when the definitive treatment is bone marrow transplant, but not many people are candidates of bone marrow transplant. It is a process that is complicated.
And very expensive.
Very expensive. Not many people in Kenya can afford it. But if we have bone marrow transplant in Kenya and trials are done, eventually we can get to that level. But then let's get to the basics. When someone has sickle cell anemia, we make sure that it is already in your blood. So you are not like any other normal child. So we have to control what makes the disease complicated. And these are basic things. When a child has cough, upper respiratory tract infection, diarrhea, those other things, we need to manage those ones first so that they don't get complicated. Then when they reach the age of like 6 months and beyond, that is when we begin getting complications, because we normally have a certain protein in the blood cells called fetal hemoglobin. It levels reduces. So from the age of 6 months, that's when they begin getting complications. So just at that, we can give them nutritional supplements, and I have to be very careful. Here we give them what we call folic acid, because you see the red blood cells break, but you need to help the body to produce more red blood cells. Then the other things we do, we encourage them to live safely. That is good nutrition, preventing infections, coming to the hospital. But the key word
and also
is,
there's some activities that they can't do, right?
Exactly, yes. Like, rigorous physical activity. And of course, a child, that age, you don't expect them to do deep diving, mountain climbing. Even a carrier is also not expected to do mountain climbing, because they can get crisis. So when we talk of management, right now, other countries have moved ahead, and there's what we call red cell apheresis. That simply just means that we put you in a machine which removes your sickle red blood cells, and we replace with the normal red blood cells. And when that is done, you can actually reduce the duration of admission, such that if it is done every 3 months, the cost is fairer. Like red cell apheresis costs like 90,000. But here is the point. When we talk to the epidemiologist and the economics, they ask you what is the prevalence of the disease. But I think we need to shift our focus from that. He's just talked about being here, then worried about whether his child is going to get crisis. We need to equate the burden of sickle cell disease in terms of economic and psychosocial burden. So think of the number of days he's unproductive. A child is admitted in the hospital, the mother cannot go to work, and the mother is also a nation builder, by the way.
And also with that,
Yes.
Daktari, sorry to interject very quickly, very quickly,
Sure.
because we're running out of time. I'm sure there are numerous challenges when it comes to diagnosing the sickle cell.
Yes.
Maybe you could just quickly
So,
tell us the challenges.
in terms of the diagnosis, we don't have a proper equipment in most of the hospitals. In the previous discussion, we talked of the prevalent the regions where this disease is common. We talked of Coast, we talked of Lake region, that is Nyanza and Western. The point is, the machine that we need to make diagnosis is called HB electrophoresis. We know we have big referral hospitals in those big counties. Have they done everything, given that cost, the issue of health is devolved to the counties? So we know when we ask about challenges are as a result of maybe the leadership. These are the people who are supposed to avail adequate resources. Sickle cell disease is not being discovered in Kenya today. It has been there for ages. And surprisingly, the planners, especially in those regions, do not talk about this disease. And let me tell you, right now, people are talking about cancer. It is much more expensive to treat cancer than to treat sickle cell. And you see, the money you spend on treating one person with cancer is enough to treat 100 people with sickle cell. So we really need to refocus on our mission, how we want to help our people so that we have these diagnostic things. And now, in the government, remember, there are procedures and bureaucracies. Before you get anything to the hospital, there's tendering processes and all those things. But those who can afford, I can tell you, they can go to private hospitals where they have these diagnostic kits. Currently, we have what we call point-of-care tests, sickle scan, which is very rapid, and you get your results within 5 minutes. Okay. If you go to Kenneth Doctors Plaza, you can get that. And I'm even very sure that where he attends the clinic, those things are available.
Okay, thank you so much, Dr. Frederick Okini, who is a practitioner of hematology at the University of Nairobi, and Peter Ahoga. Thank you so much for being here tonight. Let's take a short break. We'll be right back.